on this episode.
Did his tongue turn blue? Did he collapse or anything like that?
He has trouble breathing.
My concern's that there might be a significant amount of inflammation or infection. When I'm listening to the lungs, I can hear almost a gurgling sound. It is concerning to see that there is lung tissue affected.
1, 2, 3. So what we're seeing here is some form of abnormality. What we're gonna be doing today is a heart scan. Hello. Yes. This can really affect the left side of her heart and eventually get her into heart failure.
But first,
we never thought that this could happen to us. We never thought that the girls would go over the balcony. I was just absolutely devastated.
There's quite a lot of damage at the back of the eye. That pupil as well is not responding at all. It's more at risk of turning into a nasty cancer called a sarcoma.
And I can't see what's underneath it. I know there's an optic nerve. I know there's a big blood vessel there. Moment of truth.
in Sydney, Audrey is on her way to a house call after learning of an extraordinary case about two cats involved in a horrendous high-rise fall.
In my 18 years that I've been a vet, I've heard many crazy stories, but the one we're heading to today is unbelievable. It involves two cats falling off a really high-rise apartment block. I don't know how many floors.
Hey, baby.
Amy adopted sisters Ari and Lani when they were kittens.
They were bonded at birth. They had a bit of a rough start to life. They were found on the side of the road with their mum, who had passed away when they were just 4 days old.
Unfortunately, tragedy would strike the two feline sisters again while Amy was away on holidays.
We had someone cat sitting for us, and the balcony door was left open just a crack. Lani, being the adventurous cat she is, pulled it open the rest of the way and went exploring on the balcony and climbed up onto the railing. So Ari fell from the 13th floor as well, from the same balcony. We understand that Ari followed Lani down, probably just looking for her sister.
Neighbours put out an urgent SOS to find the owners of the badly injured cats.
We had just landed in Bali and I saw a photo and it looked exactly like Lani. I was just absolutely devastated seeing this. It was my baby. My partner and I were just absolute mess. We were on the other side of the world. There wasn't much we could do.
Hi, Amy.
Hi.
How are you?
Come in. Good. How are you?
Good. Oh, look at you.
So tell me a bit about her story.
So she fell off the 13th story balcony of our old apartment with her sister.
13th floor, that's super high.
It actually isn't that unusual to hear about cats falling out of balconies, especially in Sydney with all the high rises. And cats have this funny knack of being able to land on all 4 feet, and most of the time they get away with it, but 13 stories, that's way too high. No one's gonna survive that. So Ari is one lucky girl.
This is her. This is just how she is. But her eye, we're just a little bit concerned about. She landed in a bush. A branch went into it. She had 2 holes in her lungs.
Oh, that's a big thing.
Yes.
Say hi, Mum.
Ari, she had quite bad swelling, quite bad bleeding around her eye because it does seem like she can't see anything out of it.
Oh, buddy, that's a sad story.
Good girl, Irene.
In Sydney, Sam is bringing Irene into SASH after a routine health check found a problem with the young Labrador's heart.
It's okay.
Sam is from Guide Dogs New South Wales and is worried a chronic heart condition could prevent the placid 18-month-old from becoming the mother of future guide dog puppies.
Irene was selected for breeding future guide dogs and therapy dogs because of her good health and her temperament. She's a super sweet girl. She's very sociable, got lovely home behaviour, and she's great around kids. So we were hopeful that she would become a mum. Good girl, Irene.
Hi, Sam. Hi. Is this Irene?
Yes.
Hey, sweetie, come on, let's go.
Veterinary cardiologist Iñaki, who's originally from Spain, will try to find out if Irene's heart issue means her future as a guide dog is in jeopardy.
Tell me a little bit of how she's been getting on at home, please.
She's been doing fine. She lives with 2 other dogs and she loves to play with them. She's energetic, she gets walked daily. She will do the zoomies like a normal Labrador.
And have you ever seen her sort of having any sort of collapsing episodes or any fainting?
No, she seemed perfectly healthy.
And does she have any cough at home?
No. There's not been any, I guess, indication that she has a heart issue.
So she's behaving like a completely normal dog?
Yeah, normal lab. Yeah.
Okay, amazing. Irene has been referred to us because there seems to be some problem with normal blood circulations. What we're gonna be doing today is a heart scan. I will be having a look at her blood flow. This is gonna allow us to try to visualize her circulations.
Okay. We've got a really strict criteria with health and temperament for our breeding dogs. They're the cream of the crop. So today we'll determine whether she can go ahead and still remain in our breeding program. Good luck. Yeah. Hi, sweet girl.
Her eye, we're just a little bit concerned about because it does seem like she can't see anything out of it.
Oh, buddy.
In Sydney, Audrey needs to assess Ari's eye, which was badly damaged in a traumatic accident.
We never thought that this could happen to us. We never thought that the girls would go over the balcony. I was just absolutely devastated. Her sister, unfortunately, didn't make it. She landed on the concrete.
I'm sorry. That's so sad.
Amy has serious concerns about Ari's sight following the shocking fall.
I need to do some testing to see how much vision she's got in that eye, and the easiest way to do that is to shine a light into the pupil. That pupil should constrict when light shines through, and if it doesn't, it means that the optic nerve responsible for vision is not working. Pop the light straight into this eye, no reaction. So definitely there's no vision in that right eye, there's no response, and usually I wouldn't try to push to do any surgery or remove anything if it's stable, but unfortunately with cats they are prone to a condition where if they've had a traumatic injury to an eye, it's more at risk of turning into a nasty cancer called a sarcoma. The cancer that can form after these severe injuries in eyes is actually really aggressive. So because there's no vision there, because she's had that history of trauma, what I strongly suggest is to remove that eye, just so that we make sure that there's no chance of this happening in the future because she's been through enough.
Ari's only young. She's just 2 years old. Having the eye removed is not ideal. We would rather that she kept it, but I understand that it's what's best for her. I really didn't want to put her through another surgery and more trauma, but I think in the long run, this is what she needs.
All right, well, I'll pop her in the carrier and we'll see Mum later, hey?
Yeah?
You ready?
See you soon. See you soon.
We will start with the echo and then I'll let you know.
Okay.
At SASH in Sydney, veterinary cardiologist Iñaki is about to conduct an echocardiogram on prospective guide dog Irene.
Hey, sweetie. 1, 2, 3. Okay. 1, 2, 3.
The scan will reveal if the 18-month-old has any genetic abnormalities that could be passed on to her offspring.
We can hold her there for now. Going up now. Okay. Hello. Yes. What we're trying to look for is whether she indeed has an extra blood vessel, how much of the blood flow is going through that vessel, and then what consequences are we seeing in the heart, so whether the heart is bigger than it should be. So what we're seeing here is like we're actually confirming that there is some form of abnormality just outside the heart. I mean, it could still be a very small PDA, which that is very common. Like is the second most common birth defect in dogs.
Iñaki suspects Irene has a birth defect called a PDA, which is an opening between the two main blood vessels leaving the heart.
So there's definitely a communication here in between the pulmonary artery and the aorta.
That vessel should have closed when Irene was born, but has stayed open, causing an irregular blood circulation in the young dog.
This is blood flow that you're hearing. This extra vessel, in most cases, it will affect the animal during their lifespan. Most dogs that have a PDA untreated, unfortunately die within the first year of life. Irene's case, already she's been quite lucky. Yeah, I think this is gonna be a PDA. Just looking at the location from this angle now, it just looks like where I would expect a PDA to be. The problem with this connection is that as a consequence, she has a lot of extra blood flow that is going through her lungs, and this can really affect the left side of her heart and eventually get her into heart failure. Okay, my love. Okay, good girl. It's difficult to close it for us.
If Irene does have a PDA, she may need immediate surgery.
All right. Good girl. Well done. Well done.
Let's go.
In Sydney, Audrey is arriving at the vet hospital with Ari, who has a traumatic eye injury after a shocking fall from a balcony.
It's really heartbreaking. I can't even imagine what it's like to go through that, and for Ari to lose her sister just sounds really traumatic, and they've been through a lot. Hi, Bree.
Hi, who do we have here?
We have little Ari. I just want to have a good look at her eye.
Audrey is determined to save the 2-year-old further trauma by removing her badly damaged eye, which now has a high risk of turning cancerous.
If Ari did develop this weird sarcoma in her eye, it could spread into the optic nerve and we wouldn't be able to save her. It would be fatal.
Hi, beautiful. So what happened with her eye?
Well, she fell from 13 stories and unfortunately her sibling didn't make it, but she did. She landed in some bushes, very lucky.
You've already gone through so much. Hey.
She's so well behaved. Pop it down and I'll turn off the light.
Hi, baby.
Yeah, that's constricting really nicely.
Yeah.
Yeah.
You're such a good girl for us.
So yeah, this is definitely the bad eye. You can see there's a big scar there on her cornea.
Yeah, I can see it right there. It's massive.
And then there's some floaters and scarring at the back. And there's quite a lot of damage at the back of the eye. That pupil as well is not responding at all. So we're going to go ahead and remove the eye. I've explained to Mum that the risk of leaving it in is that it could turn cancerous.
No, that would just be terrible.
Yes, I think she's gone through too much. It can be a really hard decision to make in a case like Ari's as to whether you remove the eye or not, because it's not painful. But we know as vets, and we know from recent studies, that if we don't, this risk of getting a sarcoma is fatal. So we want to avoid all of that for Ari. She's been through enough, and if we can save her that potential, we're going to do it today.
Oh, baby.
Got to really concentrate on this, because when I remove the eyeball, if I put too much pressure or tension, I could potentially affect the optic nerve to the good eye, and she could wake up blind.
You're going to be one-eyed Ari.
So I'm just suturing close the eye. So we're up to the most tricky part of the surgery, and that's the fact that I've got to actually remove this eye globe from a socket, and I can't see what's underneath it. I know there's an optic nerve, I know there's a big blood vessel there, so potentially when we cut and remove this eyeball, there could be a lot of blood flow. So I've got to get ready to plug that and hope we can stop the bleeding. Oh, I feel like there's going to be a big blood vessel in here.
Oh no.
Moment of truth.
Hi, darling.
In Miami, Maltese Genjun has been brought in by his concerned owner, Hilda, after the young dog started unexpectedly choking.
Genjun was supposed to have a pill every day. I gave it to him last night and seems like he choked and he's having a little trouble breathing. A lot of coughing, a little difficult breathing, shaking and lethargic. It's very upsetting not to have him the way he normally is.
Hi, good morning. Hi, Edward.
Hi,
Dr.
good
Cadell.
morning. How are you? Nice to meet you.
Very good. Come over here and we'll have a look at Genjun. So tell me what's been going on. How can I help today?
Genjun took his vitamin last night. I gave him and he got stuck, he got choked.
Okay. Did his tongue turn blue? Did he collapse or anything like that?
No, he has trouble breathing. Eventually, he vomited like a thick saliva. That's not him. He's normally very active. He can stay still.
Yeah.
And this time, even last night, his body was like shaking.
This does not look at all like a young, healthy dog. I can see he's really lethargic, really flat.
Yeah, completely.
Poor guy. Well, first of all, I'll give him a head-to-toe check over. We're going to see what he can tell us from physical exam, and then we can talk about the next steps and how we can get him back to normal. He's got a nice steady heart rate, which is good. My immediate concern with this little guy is that he may have aspirated or inhaled the actual medication. Just looking at him, you can see he's got a bit of a cough. So that's where my concerns lie. When I'm listening to the lungs, I can hear a sound that it represents perhaps fluid or something along those lines, something creating almost a gurgling sound. So what we want to do now, a couple of tests. First would be an X-ray. We want to have a clear look at the trachea, the lungs and the abdomen. And we also want to do a blood test to look at things like white blood cells, red blood cells, kidney function, especially liver function as well, given the congenital problem. We want to make sure that everything's A-OK for the little guy. But if we see something wrong, we're going to deal with it.
Okay.
Yeah.
I hope so. Thank you.
Not a problem.
Thank you
I'll get
so
to
much.
it. Pleasure. We're talking about two major issues here. We're talking about a congenital liver problem, which in itself can be life-limiting. But then on top of that, we're now dealing with a potential respiratory issue. All right, little man, sorry about this. A little bit of a pinch. Good boy, good boy. One of the main reasons we're doing a blood work sample here is to make sure the liver is okay, given how that's one of our big concerns here. So hopefully we see that this rules that out as a contributing factor.
Edward is hoping X-rays will reveal why Jen June is in such poor health.
All right, little buddy. My concern with the lungs is that there might be a significant amount of inflammation or infection, and what that means is we'd have to hospitalize him. This is the last thing Hilda wants. All right, little buddy, let's get these X-rays done.
I can try to explain you. We have a vessel called the aorta. Okay, I'm just going to mark it here.
In Sydney, veterinary cardiologist Iñaki is telling guide dogs manager Sam about the birth defect discovered in potential guide dog Irene.
And effectively what happens is like you get blood flow coming from the aorta all the way into the duct and all the way into the pulmonary artery. What this creates is a lot of extra blood volume going through the lungs. The consequence of this is that the heart can really enlarge, especially the left side, and at some point it can't really stretch anymore.
An earlier ultrasound image of Irene's heart pointed to a condition called PDA.
All right, my love. It's nearly done.
Iñaki now wants to do a CT scan to confirm the diagnosis.
So unfortunately, what we're seeing in her case on the echo, we're not seeing is properly. You know, some dogs are very difficult to image in that area. So we'll move her into CT because that will give us a definitive picture of what's going on.
Yep, okay.
Based on the scans so far, plans for Irene to mother future guide dog puppies will now have to be scrapped.
So this heart issue unfortunately knocks her out of becoming a mum. Today they will determine whether she can go ahead and still remain in one of our other programs, the guide dog program or the therapy dog program, but that's what we will find out today. If it's determined that this might impact her health down the track, then we'll just resign Irene from any of those roles and she can go on and become someone's loving pet and live out her days in a comfortable home.
Ready?
1, 2, 3.
The welfare of Irene is absolutely first and foremost.
All right, my love.
Oh, I feel like there's going to be a big blood vessel in here.
Oh no.
Moment of truth.
In Sydney, Audrey is about to remove rescue cat Ari's non-functioning eyeball.
Okay, I'm going to make the cut.
All right, you're gonna do it?
I'm going to do it.
A few months ago, Ari fell from a 13th floor balcony and her eye was pierced by a branch and irreparably damaged.
I'm resting up.
Cats that suffer a traumatic eye injury have a high risk of developing an aggressive cancer.
The potential for this to happen is severe. We wouldn't be able to save her. It would be fatal.
Owner Amy is hoping the surgery will be a new start for her brave little girl after the shocking trauma she's been through.
I can't seem to get around it. Oh, we've got a bleeder. Big one.
That's a massive one.
Okay.
All right, you got it.
Along this now, eyeball. Bleeding's looking okay.
Good job.
So I'm going to now close up. Okay. All right. Super happy with that.
That looks beautiful.
Here we are. There's our new Ari.
Aww. One-eyed Ari.
One-eyed Ari.
Considering what you've been through,
I'm very relieved.
Before waking Ari up, Audrey dissects the damaged eyeball to check for any signs of cancer.
there's been some trauma there, darling.
That whole membrane at the back of the eye is damaged as well. So that probably explains why she wasn't seeing. If I'm a bit worried that it looks like cancer, then we'll send it off.
Oh wow.
No cancer though. I'm pretty happy that there's no start of any cancers. So in the nick of time. Good news. Yeah, good news. All right, I'm happy with all of that, and let's wake her up.
Sounds good. That looks beautiful.
One, two, three.
In Sydney, veterinary cardiologist Iñaki is anxiously waiting to see CT images of potential guide dog Irene. The scan should confirm if the 18-month-old has a life-threatening heart defect called PDA.
So it was more towards the left pulmonary artery. I could definitely see the blood flow clearly. What I couldn't see was the typical opening that we see, and that's what was unusual about it.
Yeah.
If we confirm a PDA in Irene, if it's large enough, it will need closure. There are two main ways of closing it. One is with keyhole surgery. The other option is just directly opening her chest, but unfortunately it's much more invasive, so we try to avoid this. Yeah, look at that. I think they're branching from here.
The detailed CT images are revealing an unexpected result.
Irene doesn't have a PDA. She does have a bunch of anomalous vessels that are connecting the aorta with the pulmonary artery. They're very, very small, very tiny vessels, and because there's so many of them, so it's making it difficult for us to follow the exact tract for it.
They're very messy, and given that they're very small, I don't really know where they're coming from.
Instead of a single rogue blood vessel causing problems for the blood circulation, as in a PDA,
I don't really know what you can do with it.
Irene has a rare condition, with a network of vessels that shouldn't even be there and are causing excessive blood flow to her left heart.
I wonder if another one is coming off here at some point.
There's so many. How do you close all of them? Because they're very uncommon. For this case, because it's so unusual, we don't really know if this could progress further. The good news is that she's almost 2 years old and she doesn't have any significant changes to her heart, which is a bit reassuring. I mean, we know what she has now, but it's not really affecting her that much. It is possible that we may not need to intervene at all during her lifespan, which would be amazing for her. In Irene's case, because her heart doesn't have any changes, she could potentially live like a completely normal dog. So we are going to advise that she goes to her normal routine for now, and we would like to see her back for checkups every 6 to 12 months.
Come on, Irene. Good girl, Irene. Good girl.
Oh, buddy.
In Sydney, Audrey has surgically removed Ari's non-functioning eye to avoid an aggressive cancer forming.
We've left enough margins to make sure that she lives a cancer-free life.
Owner Amy is anxiously waiting to be reunited with her brave girl Ari.
At home without Ari today, it was really strange. It was definitely not the same coming home and opening the door and knowing she wasn't there, but we knew she was in good hands here.
Ari is a really special cat and I've got a soft spot for her. Her personality, her story, she's just so brave. So reuniting her back with Mum today, that's a real happy moment for me.
Okay. Here's Mama.
Oh, hello, little baby. Oh my goodness.
She was the best patient.
Yeah.
Couldn't ask for better. Yeah. Very chilled in hospital.
Yeah.
She's like, hey, I've been here before.
I know what this is. I know the drill.
And the surgery went really smoothly, so it couldn't have gone any better. Last surgery ever, hopefully. And I can certainly see there's been a lot of trauma to that eyeball.
Yeah.
And so at least it's out and she's going to be cancer-free, which is the most important thing.
Yeah, absolutely.
She should be feeling a lot better by tomorrow.
Yeah, brilliant.
All right, chickadee, shall we get you home?
It'll be a few days of recovery, probably a lot of me stressing about her, hoping that it's all okay, but it'll be really good in a few weeks' time once she's all better.
Let you be a happy cat at home.
No more vet visits for a while.
No.
All right, little buddy, let's get these x-rays done.
In Miami, Edward is x-raying Jen June to try to find out why the young Maltese suffered a choking fit after being given one of his regular liver tablets.
What I'm seeing here on these x-rays, that there is a degree of inflammation or infection. You can't really tell the difference on x-ray, but it makes more sense that it's going to be an infection considering what happened. But you can see evidence of that. It's mild, which is the great news, but it is still concerning to see that there is lung tissue affected. I can't see anything at all. This doesn't guarantee there's no pill, but it gives us a lot more confidence that there's no need to kind of go in there with an endoscope or anything like that. So for now, we're going to assume there's no pill there. The good news about these x-rays is I don't see any need to keep them here, which is fantastic. I know Hilda, that's going to be her first question, so I'm really pleased to say we can try to give this a go with medications at home. While the liver is going to be an ongoing issue, I'm pleased to say that in terms of the lungs and the cough, I'd expect this to be completely fine, even within a few days' time, and it should never be an issue in terms of it being a long-term problem. Okay, we have the results ready. First and foremost, let's talk about these x-rays, and I'll take you through this.
Okay, thank you.
So, when we're looking at the x-rays, there's a couple of things to mention. You might recall how we're talking about whether the problem, the sound I was hearing, was coming from the lungs or the trachea. The lungs themselves, they do seem to be affected, but only to a mild extent, okay? There's just a certain pattern to the lungs that would suggest there's some inflammation or infection. There's also some inflammation or infection of the trachea. I would be confident in saying, with antibiotics especially, we should see him go from how he is now to how he was yesterday.
Perfect. Thank you. Thank you. Thank you so much.
Not a problem.
At least I know there's no foreign body, anything in his throat it can be managed with medication without any invasive procedure.
We'll just do a quick blood draw for that, get a heme-Q.
And you're going to place that catheter in as well?
I can do that.
And
then
At the animal hospital in Perth, Peter and vet nurse Michelle are awaiting the arrival of a rock star visitor.
today we have a patient coming into the clinic called Elvis. Hey Elvis. There's nothing wrong with Elvis at all. He's completely healthy. The reason he's coming into the clinic is to donate blood. Animals need to give blood for the same reasons that humans give blood, to provide life-saving medical therapies with blood products to patients that need them.
we have approximately 40 dogs and 20 cats on our donor register, and each of those animals donate approximately 4 times a year.
Owner Jessie has brought Elvis to the clinic as part of the big dog's regular visits to give blood.
Albus is a 70-kilogram Great Dane. I let Albus give blood because I understand as a vet student how vital it is for other dogs who are sick and need it.
Peter aims to collect 500 grams of blood, with the procedure usually taking less than 10 minutes.
Elvis is one of the most ideal blood donors because of his size. He has beautiful big veins that allow us to access his blood. He is a really calm and patient dog.
Good boy. Good boy, Elvis.
We need animals that are the appropriate temperament to go through the process, and Elvis definitely is.
Good boy. Yeah, that's good. There we go. That's beautiful. He's been such a star.
Almost there.
Blood collection done, it's time for Elvis to get his reward.
Good treat. Elvis was a very good patient as always, and he's saved another couple of lives today. Good boy.
Donor blood is processed into two products, red cells and plasma. So Elvis's contribution today has the potential to save 2 lives.
Had a good meal?
It's really rewarding. You get notified every time your animal's blood gets used for someone or saves someone's life. You get a card in the mail. It's a great feeling to know that my dog is helping others.
We've had 2 bags of plasma to 3 bags of, well, this is the 3rd bag of cells. We've probably had more crystalloid than I would have liked.
Yeah.
Later that night, Elvis's donation is already being put to work. 7-year-old Pointer Cross Leo is recovering after emergency surgery to remove a nasty tumour.
We have a very critical patient. He's a dog who has lost pretty much his entire blood volume from a tumour that has been bleeding in his abdomen, and he is being kept alive with the blood donation that Elvis gave us.
Great Dane Elvis is just one of a number of blood donors at the clinic.
Without that, this dog would have already passed away.
The team is closely monitoring Leo's vital signs, but he's not responding as well as they'd hoped.
His blood pressure.
With Leo's condition deteriorating, his owners Michael and Elise are called in.
About 2 weeks ago, he started to get quite extreme lethargy. And went off his food, so rushed him down to get looked at, and they found a lump on his liver, which is expected to be cancerous. So
he's stable, I think, but yeah, it's not looking good. So.
Peter is still hopeful the blood transfusion may be able to make a difference, but Michael and Elise are prepared for the worst.
Tough time. You just don't expect it. He was bouncing around, you know, not that long ago, and yeah, now it doesn't look like it's going to be long.
Hello, he's a good boy.
Next day, Peter has some incredible news about Leo.
So we're about 24 hours since we last have seen Leo, and there's some great news. He's up and about and looking a lot brighter than he was yesterday. Good boy. He's recovering well, and thanks to the blood products that he's had, he's looking a lot better. We've got to be very thankful for our surgeons and the hard work that they've done, but we've also got to be extremely thankful for Elvis and his blood donation, because without that, Leo wouldn't be here right now.
Good boy.
A month after being diagnosed with a heart defect that ruled her out as a guide dog mum, Irene is now making a massive difference as a therapy dog for 5-year-old boy Ethan.
Scratch your belly.
Irene's gentle temperament around children is having an amazing impact on Ethan and his whole family.
Give her a treat.
Oh, gorgeous girl.
And brave cat Ari is recovering well after Audrey performed surgery to remove her badly damaged eyeball. The little cat suffered the horrific injury when she fell from the 13th floor of an apartment building.
Hey, baby.
These days, it's indoors only for this incredible little miracle girl.
Oh, gorgeous girl.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way.